In this morning's Woman's Doctor, how long is too long when it comes to your period? Mercy Medical Center nurse practitioner Nicole Hammond says there are some common benign things that can cause a prolonged period.
Hormone changes is one of the most common benign reasons that a period could be prolonged. Things like uterine fibroids or polyps, which are benign growths. Certain conditions like endometriosis could cause prolonged periods. Or it could absolutely just be nothing.
And joining us with more this morning from Mercy is gynecologist Dr. Latasha Murphy. Good morning. Thanks for joining us.
Good morning. Thank you so much for having me.
Let's address the first thing that Nicole talked about, and that was hormonal changes. So what would that include?
Sure. So there are a number of hormonal changes. For instance, sometimes people who have issues with thyroid dysfunction can have prolonged cycles. There are other things such as going into that perimenopausal time frame, your hormones are fluctuating, estrogen is getting lower, and those things can change the length of time of the period as well.
What about severe calorie restriction? For instance, if you're on a super low calorie diet or you have any sort of maybe eating disorder as well?
Sure. So generally when that happens, the cycle actually stops, not become prolonged. So it kind of puts you in a situation where the body feels like it's deficient, and oftentimes that is linked to a lower estrogen level, which doesn't allow for cycles.
Listen, most women would agree that the traditional 7 days is too long as it is. So if you go any beyond that, you're probably going a little bit crazy. So when do you, yeah, right? So when do you start to look at it like this is more than just something benign that's going on?
So truly, as Nicole mentioned earlier, if it is consistently lasting longer than 7 days, that's just entirely too long. I would definitely say if someone is bleeding more than 10 days, you should go and get evaluated probably pretty quickly. If it lasts 8 days, you can maybe watch that for a month or two and see how that goes. But if it's 10 days or beyond, that's too many.
So if someone is listening to this right now and they're hearing that and their period is lasting longer and they might be starting to get maybe a little bit worried or anxious about what that could mean, what could this mean?
So as mentioned earlier, most of these things are benign causes. In particular, fibroids are really common in causing prolonged periods, especially if they're located within the cavity of the uterus. The other thing is a polyp. Polyps are benign and tend to be a vascular growth, which can prolong a cycle as well. But there's one other thing that wasn't mentioned in the earlier segment, which is adenomyosis. That's when the inner lining of the uterus grows into the muscle, and that can prolong the cycle as well as make it pretty heavy. So for the most part, I think that the benign causes are more commonly linking to the prolonged cycles.
All right, so instead of being worried, just go get it checked out.
Exactly.
All right, doctor, thank you so much for joining us. Really appreciate it.
Thank you so much for having me.
You are very welcome. And if you have any other questions or you'd like a referral, just call 1-800-MD-MERCY.